All righty. This is another episode of the Autonomic Dudes, and we actually have a dudette with us. Again, I'm Dr. Rob Wilson, and we actually have my trusted dear friend and colleague, nurse practitioner, NPRN, Kyle Shannon.
APRN, I'm not NPR. NPR is a national news.
Once in a day. Kyle Shannon, our illustrious and golden summer intern, Nick. And then we have our patient liaison and dear colleague and friend, Linda, from Lunch with Linda, who I think is also Anytime Linda, breakfast, lunch, dinner. So Linda, you're our
Yes.
first guest. And
Thank you.
yes.
Thank you.
Yay,
I'm glad to be
Linda.
on.
Yes, we love Linda. We love Linda. I've been waiting for this moment, but we're gonna discuss a lot of medical and a lot of science, and we're gonna get into a little more of the intimate stuff. And I'm gonna let my colleague, Nick, who's just been phenomenal with a lot of patient experience, lead us in a little with this. You know Nick from before, so he's
Hello.
back.
Yeah.
Perfect.
Yes.
Okay, so I was thinking today we could just mostly talk about like the personal experience with POTS. Like before, we've talked a lot about the medications, the treatments, basically what is the very scientific side of it. I was thinking today it'd be a lot better if we could get the more personal side of it, the real story of someone who has had POTS, who has had to live with POTS, who has had to endure POTS, and how they have been able to live with it. I think that'd be very interesting perspective to see. And that's why we have Linda right here.
I mean, Linda, I've known you for a long while now, and you've had this new evolution of self. So share us in the next 20 hours.
Yes, just a tad. So,
Yes.
do you want me to go ahead and just kind of introduce myself?
Yeah, go
Give you a
for
little
it.
history about
Yeah.
myself. So I've had POTS now for 7 years, 6 years knowing I have POTS. The first year, I was working full-time job and I kept getting sick. I had a stomach flu January 1st of 2018. Every 3 weeks, I was throwing up. I was in the ER a total of 14 times that year. I saw functional medicine that year, a lot of gastro doctors, a lot of testing, and then my PCP is the one who noticed my stomach was extended and sent me for a tilt table test. And then that's when I was diagnosed in 2019 and came into Cleveland Clinic, saw Dr. Wilson. So my life has changed a lot, but I have a lot of good things that came out of having POTS.
Yeah. I mean, the first year, I want to jump in there as we go through this together as a team sport, and like Kyle talked too, is that I think the first year I use the word avalanche. You go from this point, any patient is like, what's going with my body? And then you get a diagnosis, and there's this aha moment of, oh, yes, answers. And then it's sort of like this another door of trying to live through this, of this another confusion point. I think first year for you is like this, like, okay, now I'm gonna absorb as much information as I can, as much I can get through. And that maybe works to a certain degree, but at some level, it's like, what do I gotta do with it? It's often like practical, simple steps of get going, right, Linda?
Yeah, absolutely. So I remember when I had to go get the tilt table test, and I was like, oh, this is another test. It's going to come back saying it's normal. And the neurologist came in, and then I was near ready to pass out. But I've never had that feeling before until the tilt table test. And he said, okay, she failed. And they put me back. And I said, what does that mean? And he said, well, you have POTS. And I said, what's that mean? And he said, oh, it's not much. You just have to drink a lot of water, consume a lot of salt, and exercise. I was like, yes, like sign me up. I got this. This is easy. And so I went into the hospital to see a neurologist at my local hospital to learn a little bit more. And at that time, my son was researching, and everything they were pulling up was the same thing, salt and exercise. So like my family was ready to put me on and I was walking then too, even though, because I was having panic attacks and everything, but my family was ready. Like, oh, this is 3 steps. We got this. And as we progressed, I kept learning more and more. And when we get near the end of the podcast and we kind of talk about what worked for me, you'll go, that sounds too easy, but it's not. But it's harder than salt, water, and exercise, right? That's a lot more involved than that. But once you truly learn about it, I went to a lot of shared medical appointments with my doctors. That really helped. So, yeah, that's kind of like the beginning phases, the first year, and then finding out is gathering all that information.
Linda, can you tell me a little bit, because everyone's at different, right? We have teenagers that get POTS. We have people like you who are in a successful career, very busy lifestyle, mom. What was the experience like having kind of the, for lack of better terms, the carpet ripped out from underneath your feet? Like how did you take that emotionally, and how did your family respond to that? Because they're used to somebody who, again, high functioning, go, 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 to someone who's no longer like that energetic, I can conquer the world individual. How did that kind of, that sequence of events go for you? Because we know that that's a very frequent thing, that a lot of our patients kind of have this, someone turned the light switch on them, and then all of a sudden their life has changed. What was that experience like for you, and what was it like for your family?
Yeah, absolutely. Great question. So basically, for me, like you said, I lost my career. It was originally, we're going to get you on short-term disability. I kind of disagreed, but I thought, okay, that's good. That gives me time to like learn what's going on. And then it ended up moving from short-term to long-term. And I was the breadwinner of the family. I also was the one who lived 4 doors down from my parents, and my dad had had a massive stroke. So I was helping him. So I was kind of the glue that stuck it all together with the family. And that just went when I ended up having POTS and getting so sick. And the family just didn't understand, why do you keep getting sick? Questioning everything that I was doing moving forward. We actually had to move, we had to downsize. So a lot of things changed in my life. And it was like 2021 was probably the hardest year. My son was getting married. I'm trying to act like, you try to act like you're normal, right? Meanwhile, you're sweating, you feel nauseous, and you think you're pulling it off, but you're really not. Um, so yeah, life, holidays changed. I upset a lot of family members because I had to say, I can't do it. I can't go. There's just too much noise with the kids. And people really took that personally. Instead of understanding what was going on with me, they took it personally. Like, oh, Linda just doesn't want to come to Christmas anymore. And Linda's moving because she doesn't want to help anymore. And the family struggled with that. And my circle got a lot smaller, and I realized those who I can really depend on, and they are the ones who took the time to understand it and actually spend time with me.
Linda, I
Why do
love
you,
that, Linda. Oh,
I was
sorry,
just gonna
Kyle.
say, why do you think, I mean, I have an idea why, but why do you think that people felt that you were just making an excuse, or being lazy, or running away from problems? Why do you think that is? Like, what is it that, yeah, we kind of know this probably, but what do
Yeah,
you think it
I
is that
know.
your family thought this?
Women. It's a disease of women. I'm going to say it first. It's a disorder of women. Women take care of the world in the prime of life, and they're used to taking care of people. You know the answer, Kyle.
I want to hear it
Yeah,
from Linda, Rob.
yeah, no,
And
Kyle.
Linda, you're invited to any holiday meal at my house. You always have a
Okay,
seat.
good.
Bring your family, bring your husband. You're always welcome. And Nick's invited too. So is Kyle. We'll hand back to Nick in a
Good.
second.
Thank you.
So when you asked that question, Kyle, and you said the word lazy, it brought me right back to this conversation. My oldest son had moved out with his girlfriend. So he wasn't there when I originally got sick. He didn't see that 2008 where I was bedridden every 3 weeks for a week, just in the dark, no TV, no phone, not able to do anything. So he didn't see any of that. So we actually had a meeting because I ended up going down to Dallas because I was trying to find answers. And he was mad at me because I asked him to go pick something up for me. And he's not used to that. Mom always does it. And even though he was 21 years old, he still wanted mom doing it. And he said to me, I think you're lazy. And that was a hard pill to swallow because in my head, I'm going, I'm not lazy, and how do I get this across to him? And my son, especially my son, who is not about doctors, he's all about eating healthy, so he gave me a million reasons why I ended up with POTS. I am happy to say now he's 27 and he's like my best friend, and he gets it and he understands it and he knows if I have to cancel. But yeah, that was hard. And my dad, go out and exercise. Well, if you just get up and walk around, I was raised that way. If you're sick, get out of bed and walk, you'll feel better. So I kept getting told that, and I kept pushing myself. And it was just a vicious cycle that kept going and going.
Yeah, I mean, all those feelings about guilt, shame, acceptance, abandonment, loneliness, alienation, marginalization, I really do believe it's a syndrome of young people, knocks the prime of their life, and the word is confused. Nick, I know you want to bring it up to some stuff here. You've really been thinking about this topic.
Yeah, I really wanted to ask you because I always see you so like upbeat and full of energy, like in those lunch with Lindas. I'm serious. Like you're always very passionate about like sharing your experience. And it's like, I just wanted to ask, like, how do you keep that mindset, that good mindset? Because I noticed that that's like the biggest differentiator between patients that I see is the mindset that they carry. And I see you with such a good mindset about, at least from the outside perspective, such a good mindset. I'm sure it's very different inside. So I wanted to ask you about that, how you maintain.
Absolutely. Yeah. I always say I would love to have a hidden camera on me one day and like not know I have that hidden camera on me so everyone could really see what you go through. So yeah, you probably always see the smiling Linda and the I'm not going to give up attitude. But trust me, still to this day, there's moments where I am just crying and I will tell my husband, you just need to leave me alone. I'll get over it, but I'm just like so devastated that I can't do something or I can't, go to an event. I'm letting people down. And then also, don't even mind all that, all the symptoms that I'm dealing with. And my worst days are the days where I get to the point where I say, I'm just sick of being sick. And those are the days that are the darkest. And how do I pull out of them? It's a lot of hard work. I'm not going to lie. It's a lot of therapy. So I see a psychologist whose wife actually has POTS for 15 years.
Incredible.
So I got
Incredible.
lucky with that. But, I learned a lot from him. He told me, because I always said, I used to be able to do this. I used to be able to do that. And he says, you got to stop looking at what you used to do before you got sick. Start looking at what you can do now that you couldn't do when you first became sick. So when I look and say, wow, I was bedbound. I wasn't able to watch TV. I wasn't able to text. I would never have been able to sit here and do this. So when I'm getting down, I pull myself out by going, wow, look at what you're doing now. Look at what you're able to do. Yeah, you have those bad days. It's okay to cry. It's okay to be mad. It's okay to be upset. But I got to brush myself up and just keep moving and just work. I mean, that's my goal. Somebody told me one time, just keep working for better days. So once I got that mindset, like as long as I'm having more better days, I'm in the right direction.
That's great.
So
I'm really
Linda,
happy to hear that.
So Linda, I have a question for you. A lot of times in these visits, Kyle and I do, and Nick does this too, we're always telling patients are beating themselves up. That scrutiny, the people around them are scrutinizing them. We're telling people what they're doing right each day. Is that a good thing that we're doing? Telling people, because
Yeah, absolutely. I mean, I remember my first appointment and talking, and saying, we believe you. So having a physician saying, we believe you, we know it's not just anxiety, that helps tremendously. So yes, listening to the patient, understanding the patient, and knowing like we're in a safe place. Because for so long we saw so many doctors prior that might have told us it's anxiety. I went to a psychologist and psychiatrist in a gut digestive disorder clinic. I did hypnosis. So and then in your mind, you start to go, I remember that year before I was diagnosed going, am I losing my mind? Maybe it is me. Maybe I'm not really sick and I'm just making myself sick, worrying about being sick. So once I got the answer that there was something. And then once I learned that it is more than salt, water, and exercise, then I started to realize like, wow, this is really going to impact my life.
How often did you hear the terms, you look fine?
That all the time. I hear all the time about myself, Kyle.
Yeah, I know, Rob, we get that all the time. You look fine, Robbie. You're looking good, baby. But how often do you hear that, Linda, where they'd say to you, well, I don't understand, Linda, you look fine. And how does that affect your psyche when you hear that? Like, that has to really be like demoralizing.
Yes, because we're not going to show like actually how bad it really is, like walking and our heart rate. Like there's really no visible way of just really showing that. So, except for like the sweating and like all that's happening internally. So it hurts. It definitely hurts when they say that. Um, I was when I gained a lot of weight. So that's what I've been fighting with. So then I think that's when my dad and that started to believe, because look at, she's gaining all this weight. And my dad would introduce me to people as, oh, this is our daughter. She has a disease and that's why she's heavy. So
Oh,
so there's brutal comments that happen to us patients.
Yes.
And then you just got to go like, I'm not going to listen, in one ear, out the other.
yeah.
Vent about it to my husband. I vent about it to my sister, and we actually would go see Santa Claus every year. And my dad introduced me that way to Santa. And he said, well, that's one heck of a way to introduce her. And I was like, Santa?
Santa gave your dad coal. He got coal that year.
Santa's good. Santa's good.
Exactly.
All right.
I was like,
Nick took it
high
out.
five. Yeah. So
Nick.
it hurts. It definitely hurts.
Wow. Yeah, I can't imagine that. I mean, because you're just trying to like get through your day just like everyone else. And you know, when somebody, I mean, I always tell my patients this, like when I get the flu, especially when it comes to like when you hear the comment, oh, just go exercise, which again, you know how we feel about that, Linda. Exercise
Right.
is a big proponent. It's
Right.
not, it's a big key in recovery, but like
Right.
when you're just kind of slapped on the back, patted on the shoulder, hey, good luck, go exercise. It's demoralizing as well. Because then I always tell patients, well, if I felt like I had the flu, ask Rob. I'm a big baby when I'm sick. My wife,
Pacifier.
I am the drama king up here when it comes to being sick. So there's not a chance that, and I work out every day. There's not a chance that I'm working out when I have the flu. But that's how you guys feel when
Every day. Yeah.
it's demoralizing too. I mean, so even not only is your family, you know, sometimes really making comments to you, I think as healthcare professionals, we have to be educational when we're talking to you about like why it's important, not just go figure it out, go back to the gym. We have to explain why is that important, right? I mean, I'm sure you've had that experience.
Yes.
Yes. I wanted to add on to that. And just,
Go, Nick.
I wanted to add on
The
to
drama.
that.
We'll move from the drama llama.
I like to get into that.
No, but
Come
that
on,
was
that's
perfect.
That was great. I just wanted to ask, like, because based on this, like on the exercise and also just like on what you were saying about your gradual way back up and like, oh, I can do so many more things that I wasn't able to do before. What was it like for you? Like, what tips or tricks or like, what tips or tricks would you give to people that are at the very beginning of stages to get to where you are now? And I know it's not the same for everybody, but yeah.
Right. And I think that's where I always say this, we're so much the same but different, which sounds so odd, but it is true. We're all at a different part of our journey, a different a time in our life when we get this. So I did do the exercise thing. I did the cardiac rehab program, and I was doing the elliptical like 4 times a week up to like 45 minutes a day. And again, this was back in 2019. And I remember saying, like, look at my book, look at my binder. I'm not getting better.
Oh, your
And
binder.
yeah, here's my binder with all my blood pressure and heart rate, and I'm not getting better. And I think if I would say the advice I would give to somebody today, what I didn't do is don't give up. I gave up. I gave up on the exercise. I didn't put myself as a priority with the exercise, which I think is a huge component, like you said. I think if I maybe would have just backed it down and not been doing the 45 minutes, I would have probably started to see some improvement. If I would have done, even just lifting a can of soup and just kind of keeping my strength, I don't think I would have seen me go downhill as fast as I did. So I would say don't give up. If you feel like, oh, I've done this for 10 minutes and I'm wiped out for the week, do a minute. Like move your legs in bed. And I started to do that. I got in a elliptical where I can sit in the couch and I can just pedal and I can just say, okay, I'm only going to do 2 minutes because if I do 5, I'm wiped out. So you find ways. I love to swim. So I did, however you pronounce that, water therapy. And that helped a lot.
Excellent.
But don't give up. That's probably the biggest piece of advice. So slow
I think
down
That's great. Yeah.
and
Yeah, I
don't
think
give
it's
up.
easy too, Linda, right? Like we often tell people cardiac rehab, or people hear about the Levine protocol, CHOP protocol, and I'll be honest, if you told me to be on a bike, a recumbent bike, I would go nuts. I tell people that, when it comes to that part of the journey, find something you enjoy, right? I mean, no one wants to spend time every day doing something they hate. I have one patient who she tried the recumbent bike, she tried walking, she just walking was just too much for her at that point in the journey.
Mhm.
And you know what she ended up doing? Hula
Oh,
hooping.
the hula hooper.
The
Yes.
hula hooper. And when she came back,
Awesome.
I kid you not, she's like, I love hula hooping. I said, you know what? At this point, like I was early in my career, and
Right.
I was like, whatever, go for it. I don't think it'll work, but go for it. She proved me wrong. So she started by using hula hoops, laying down, just kind of like swinging them around her arms, then her legs. Then she got to the point that she was upright. And then I'm like, she came back and she was like amazing. I still see this patient, love her.
Well,
She has a full career now. She's like happily in a relation. It's like she's my feel good, one of my feel good stories every time I
Right.
see her, because
it
she took
shows.
something that's a miserable experience for a lot of patients and found
Yes.
something that she enjoyed and made it like this light, this like path of light for her.
Right.
And now she's awesome. So it's that the takeaway is don't give up and find something you love.
And it shows
Correct.
this idea, and I know Nick wants to jump in there too. It shows that if we just move things from the negativity, as this theme of this conversation, away from the negativity, the scrutiny, and the harshness to affirmations, like positivity, allowing any little victories, just cherish and acknowledge. You can move to this light. I'm not saying it's gonna be easy, but like celebrate what you're doing. Celebrate what you're doing. Nick, you want to
Oh,
say something? I can see
yeah,
you
yeah.
just
I
jumping in there.
a
You got
mindset
three
that
chatty, one chatty Kathy and 2 chatty Carls.
pretty much, yeah. A mindset that I personally live by is to get 1% better every day. And you're not going to be 100% as soon as you get diagnosed. The next day, you're not going to wake up, boom, you're safe, you're good. But you can get up 1% better every day. And it's not much, but over time, it adds. And soon you will get to where you want to be. It's all about that. You got to stay committed and you got to stay, like you said,
Believe in yourself. Believe in yourself. Don't
yes.
give up on yourself. People often make you feel shame and guilty and lessen yourself. It's like what chronic health conditions does these things. People get really this talk inside themselves. People make them feel that way. And you got to believe in yourself. It's an active pursuit. Active. That's what I really try to emphasize. Linda, you do that too. Nick, you're spot on. You can't give up on yourself. Right, Linda?
Journey.
Right.
It's a journey. It's not a pit stop.
Yes. Yes. And Cal's right. If you had the flu, would you feel like doing any exercise at that point in time?
No.
Anybody,
You're talking to Rob. Rob will do it.
well,
He's nuts.
he's an exception to the all rules.
Nuts. He's nuts.
So,
Yeah,
yeah.
yeah.
For
I
normal
worked when I was in
people,
the hospital. I worked when I was admitted to the hospital.
Yeah.
yeah,
Perforated.
yeah, I know.
That's a whole different story. That I need to go to your therapist, I think, probably with you. But no, but Linda, you're right. You're
But
right.
yeah, so you don't feel like doing it. You don't feel like moving. So I think I would say the other piece of advice I would add to that, there might be a day or two you don't move 1%. You just stay status quo, or you maybe go backwards for a little bit. And we are our worst critic. I will be honest. Like, I am my worst critic. I don't see the wins. And I noticed that with doing lunch with Linda and talking to so many POTS patients. They'll be like, I can't do anything. I'm laying here, I'm sick. And they're like, well, wait, I got to go before it gets too hot because I'm going to go do a 2-mile walk. And I'm like, that's a win. Or I had somebody who cut the grass and they were so happy that they were able to cut the grass. And I always say, just take those wins, realize what you're doing, because we're our worst critics.
Yeah, thank you for adding that, by the way, because like the 1% every day, that's like take it with a grain of salt because it's okay to not get 1% better. It's okay.
Yeah.
But
Yes.
And
or not letting those negative people into your head, right?
Yes.
Not letting those people into your
yes,
head.
yes, don't drown in that woe is me, I would say. Know that POTS is an emotional roller coaster. I wasn't prepared for that. I thought it was all going to be just physical. So I was not prepared for the emotional part of it. The days that I felt amazing and I was like, I'm going back to work. I was driving and I'm like, this is great. And then bam, I'm back in bed. And it still happens to this day. The other weekend, I was like feeling great. I did 3,000 steps, which is so not like me with everything.
Mm.
And I did 3,000 steps. And I was like telling my husband, like, where are we going to go? Because we're going to travel. We got lots of years to catch up. And then by Monday, I was like back. And those are the days that are hard. And then I'm crying. And then my husband reminds me, like, you're in a flare. You did too much. So be over it, and it is like, okay, I got to get over it. I know this isn't going to be, I'm not going to feel this bad in the negative side the whole time. I am going to have my better days and they're right around the corner. So
Yeah, that's well said. It's well that modulating yourself and patience, right?
yes, yeah, and it's so much more like it takes time to get to even where I'm at. So it does take time to get
Yeah. So we have,
where, because it's
yeah.
medicine, it's emotional, it's physical. So there's all these components that you have to deal with on top of life. Life just happens
Yeah,
on
you're
top
right.
of everything.
I kind of wanted to ask just for my own like edification, because I hear patients say this all the time. But from your personal experience, could you describe what a POTS attack would be like? Because I've heard that a lot. It
Oh,
looks like,
Question. Good
yeah.
question.
really good question. Really good question. So for me, I get a really high heart rate when I stand up. And even right now, when we're doing this, I can feel sweat dripping down my legs. So I will just sweat like crazy. Nauseous. I get extremely nauseous, throwing up. I've had to learn what my food triggers are because I'll throw up. So a really bad flare is I have a horrible migraine. I have my headache hat on and I'm feeling extremely nauseous or throwing up and my just stomach is upset. I don't want to eat anything. Sensitive to sounds and light that's probably what I would say is what I consider my flare.
Hmm. And
Yeah.
is that
Hope
constant or
that helped.
is it always triggered by, is it constant or is it always triggered by something or is it like intermittent?
It's for me right now, it's intermittent.
Okay.
So I mean, I said this from day one, like I could conquer the world from my recliner. If I'm in my recliner, I have booked so many tickets to concerts and shows thinking like I feel great. It's when I stand up
Oh yeah.
that's when I start to feel like I got to go bending over. So constantly dishwasher, picking things up, that'll send me to where I need to get to that recliner. But then I also have to get over the fear of not wanting to leave the house or not get off the recliner. So you're playing mind games that way too, because I feel best when I'm in the recliner, but I know that's not best for my health to just stay in the recliner.
Yeah.
But so yeah, it's intermittent. If I go up the steps on a bad day, forget it. Forget it. A good day is when my husband sees me going up and down the steps like 3 or 4 times a day. He's like, wow, you're doing good. So that's a good day. But when I can't even, like, it's a marathon to go to the bathroom and back, then that's a bad day.
So Linda, building on Nick's great question, what would you say for people who listen to this? A lot of patients are going to listen to this, and healthcare providers who won't listen to this, understand people go through. What would you say? We have like 5 minutes left, and all of us are very chatty. We all want to jump in here today so much. We're very good together. We have good intentions. What would you say in a minute at most to a family or support person the best way to be? We heard a lot about scrutiny, negative comments, people called neurophobia, don't understand neurology, medical literacy, don't understand. What would be the best way for a family person to be with somebody or support person with someone with POTS to be?
Best way for a support person to be is just understanding, know. So I'm going to try this in a minute, but like know that, hey, she might not be able to go out to dinner and sit at a dinner, but she can come, I can go to her house and we can have dinner at her house. Being accommodating, I think that's huge. Being accommodating, being caring, understand, look for symptoms maybe, like, oh, her feet are turning blue, and kind of recognizing that. My sister can recognize when I'm getting overly tired. So I would say, like, just really start to focus on their actions. You will see POTS, even though we say it's an invisible illness. And I would say to also the POTS patient and the supporters, don't get drowned in Facebook posts and the doom and the gloom, and don't like send like, I read and you need to take, because I think the POTS patients are one of the most resilient, motivated, sick people out there that will try to find everything and anything. So the family members don't need to add on to that, or your support system.
So I'm gonna jump around that. We have like 4 minutes left. That was gorgeous. Everyone has like 30 seconds to say what they think would be the best way to support someone. I'm gonna build on that theme. If you're a support person, I think the best thing you can do is don't rush to a quick answer. Pause, hold back, sit on your hands if you have to, close your hands over your lips, active listen. Don't rush to a quick answer. Nick, what do you think would be a best way to support somebody? You've seen a lot of patients. You're a very thoughtful young man.
I think in my personal experience, I think the best way is to try and understand their personal experience. Like, I asked a lot of questions because it's all very unique to that specific person. I try to understand what their brain fog feels like. And I've stated it before in like previous podcasts, what their fatigue feels like, what their pain feels like, because it's very, very different, and it can show a lot about what's happening inside of them.
Yeah, so wonderful. Kyle, you are a seasoned pro. Lots of patients. Patients love you. They come back to see you, even though you're a
They
drama
do.
mama. I'm gonna post that. I am.
I just like to get into the meat and potatoes of what patients come in and talk about, right? I mean, Linda kind of lives that life. So we just kind of hear it second, third hand, right? But no, I think my advice to a new patient would be patient with yourself.
Oh,
And because it is a journey. It often doesn't, be patient with yourself, be patient with your healthcare provider, because it's not a perfect science. POTS is not a perfect science. There's not one medication that works well we can't just say perfectly every time and get it right on the first try. This is the exact med that's going to make you feel amazing.
Right.
And in addition to that, the medicine doesn't cure the disease. And so you have to understand coming into this that it's a battle, that yes, we can do things to try to help with the symptoms, but you're going to have to put in a lot of work, and the work can take months and months and months and months, if not years. And I would encourage you to be resilient, because it will pay off at some point, whether like Linda's talked about, like we alluded to with my one patient that we kind of with the hula hoops, it took her months, but now she is doing great and moving in the right direction. So just be resilient, don't give up, and be patient with yourself and be patient with us, or your other healthcare professionals, because for us as well, our duty is to try to help you with your symptoms, but we're not always going to get, it's not, again, there's not a perfect science. So we're there to listen and try to help.
That's so true. Building on both your points, I'll be quiet this, but is that there's a lot of medical predatory out there now for autonomic, this or that, and we have like a minute left, but really, it may not be a quick fix out there. Nick, any last wrap up before we get going?
Yeah, I also want to say I don't think I have the perfect words for this, but listen to your body, but also talk to your body and try to say, this is something we can do. This is something we think we can't do, but this is something we should at least try. Try and
Linda?
talk to.
Yes.
Wonderful. Linda, we got 20 seconds. We're running out of Zoom time.
Yeah, real quick, no problem. Make sure you have a good professional team. Have your PCP kind of lead the way on everything and testing. Don't go and try 500 things at one time, and then you don't know what worked, what didn't work. Go with one thing at a time. And like Kyle said, give yourself grace. Know it's going to take time, and listen to your body.
Yeah, great words. We're going to end on that note. What a wonderful group today of compassion, understanding, low scrutiny zone. And Kyle, you're not a drama llama. You're a good man. I'm a voucher of
My
that.
wife would disagree, but yes.
I know
I
you for
was,
decades.
I was nervous because Kyle was going to be on.
No, he's
Why does that make you nervous?
All right, all right.
Oh,
we're
I gotta
wrapping
know
up.
this. Why
All
does
right,
that?
all right, all
Whoa,
right.
whoa.
This is ending. For those who are listening, spread it forward. This is an important episode. Send to your other POTS people, and those with POTS, send to your family support people. Let them listen to this. Nick, excellent job organizing us. It's
Thank you.
cat herding.
Good job, Nick.
Cat herding, Nick. Put it on your resume. That's all of you.
Thank you. I hope you guys have a
Bye,
great night.
everyone.
Goodbye.
Bye-bye.
Thank you for listening. Bye.
Great.